Great. So let's just go ahead and get started, and people can obviously join as they arrive. My name's Amelia Bono. I use she, her pronouns, and I'm the executive director of Shout Your Abortion. SYA is a nationwide organization working to normalize abortion and elevate paths to access regardless of legality. We make resources, campaigns, and media intended to arm existing activists, create new ones, and foster collective participation in abortion access all over the country. Abortion Academy is a monthly webinar series where we introduce you to one of our exceptionally brilliant colleagues. And we hope that these sessions will deepen your knowledge, help you connect some of the dots between issues that you're navigating regionally and what's happening at the national and international level, and ultimately to give you fresh ideas to take back into your community. Audience members will be off camera and muted for security reasons, but you'll be able to ask questions using the chat feature throughout the session. And also, we're super excited that this is now our second Abortion Academy where we have Spanish interpretation available. So if you'd like to use that, and if you'd like to hear this presentation in Spanish, you can go to the bottom bar of the Zoom app and just click on the little globe and then select the language that you'd like to hear the presentation in. So we are going to be hearing today from Gina Martinez from the Colorado Doula Project. And we're going to be hearing about the Colorado Doula Project, including an overview of, like what is an abortion doula? What do abortion doulas do? And hear from Gina about just the range of ways that the collective supports abortion seekers, how Colorado is so incredibly and specifically important within the U.S. abortion landscape, and why it's so important that folks find ways to work outside of the broad medical system. And ultimately, like how regular folks, like all of us, can make big things happen in your community. So Gina Martinez is the director of Colorado Doula Project, which is an abortion fund and practical services collective based in Denver. CDP is a grassroots nonprofit organization that provides free logistical, financial, and emotional support for people accessing abortion in Colorado. CDP offers procedure funding, travel support, rides, and free emotional support via a cohort of trained volunteer abortion doulas for anyone having an abortion in Colorado. CDP is both a local and national organization, serving both Colorado residents and people traveling to Colorado from anywhere in the world for abortions at any point in pregnancy. So with that, I will hand it over to you, Gina.
Hi. Uh,
Hi.
oh, there I am. Okay. This is really exciting. I'm really happy to be here. I'm in a hotel room, and I'm usually, when I'm in any meetings or on any Zoom calls, I'm in my bedroom with my cats crawling all over me. So this is really lovely. Um, yeah. So Colorado Doula Project began almost 10 years ago. Um, and we started with just a few people on what I'm sure is now a defunct message board for full spectrum doulas. And there was like a little regional board, and some of us thought we should get together in person. Um, and at first the practical support aspect, um, the rides and all the logistical things weren't on our radar as much. Um, Usually when I tell this story, I talk about the fact that it was like me and three hippies a um, in a co-op living room, which is absolutely true. Um, and we started out based in Boulder. We started out as the Boulder Doula Project. And, you know, in the beginning, we really didn't know what we wanted to be. We met every other week in person, which is really crazy to think about now, like getting people to meet in person, like at all, especially like, um, you know, post the half-ass lockdown that we had, um, is pretty remarkable. And meeting every other week too. But we met really frequently in person, and that I really credit that to a lot of what gave us the foundation that we, like our team has now, our core leadership, um, because we really built a lot of friendships and you know and connections to each other that way. But really, the main thing to our work was figuring out what was actually needed in our area. I mean, this is way before Dobbs. This is before SB 8 in Texas, the bounty hunter law. Um, this is, you know, probably 8 or 9 years ago that we started. And one of the things that really changed for us was talking with an interfaith group in the area that, you know, that had a small fund for people seeking an abortion, and um, and you know just connecting with them about what was needed. And something that they said to us was, you know, we have this little budget that we can help people with, and what we don't have is any rides or any assistance getting people to their appointments, or you know places for them to stay and things like that. And they were getting a lot of requests for that, and it was something that they couldn't help with. And so we said, oh, we can do that, which has been how we respond to a lot of things um, over the years. And so we, you know, really started looking into providing that logistical support, honestly, with our core group at the time. We did not have like another volunteer cohort like we have now. Um, and so it was me, myself, and Melissa Walton, who is our deputy director now, and a couple of other people who were really doing all of the rides and things that people needed. But you know, we didn't have the clinic connections that we have now. We didn't have those relationships, and you know, we really had like very few people that we were, you know, giving these rides for, which is great because that was it was great to start off slow. Um, and as we went along and we, you know, got to know providers in the area, and you know, kind of show up in a way that showed that we, you know, were trustworthy, that we were reliable, you know, that kind of thing. We started slowly getting more referrals, and you know eventually we had a website where people could find us, um, and you know we would get referrals from people who just knew someone who was coming to the area. It was really kind of all over the place. And you know during that time we wanted to have more training for ourselves. And you know, this was, gosh, this was, like I said, this was like, now at this point, it's like 5 or 6 years ago. And the only group that we knew of that were doing any sorts of training at all was the New York Doula Project. And um, they had a program to train people, and we were really excited about that. So that ended up not panning out for them to come and train us through their model. Um, and we ended up having this like really, you know, this significant, I can like remember where I was. I can remember like so many things about the conversation. And we were on a group call, and one of the people in our group said, you know, why don't we put together our own training? Like we have most of us were trained as birth doulas, which a lot of the ethics that we had been trained in as birth doulas had overlap with doing abortion support and being an abortion doula. And miscarriage and fetal loss is something that occurs, it's not uncommon in pregnancy. So there was also that overlap of training. And, just because we were people who were passionate about full spectrum doula work, we also had, um, some of our own connections with other organizations and other, um, doulas and things like that. And so we started to put together our first training, which we did in person. And we built that first training as a 2-day training, which was also fairly different from how things emerged at the time. It's a lot longer. Um, it's still a lot longer than a lot of other trainings. And part of the reason for that is that we try to touch on some aspects of the work that don't seem directly relevant maybe for some people, but we have some aspects of racial justice, of barriers to care, of maternal mortality for Black women, of some sort of 101 foundation in trans affirming care around abortion. So, even though our training has changed just tremendously since then and really grown and improved, we really started out wanting to make it more comprehensive than just the basics of abortion and, sort of how to provide emotional support to people, which is not a critique of any other trainings. It's just something that we came into this work doing differently. So that first training, it was really like, we had never done anything like this. We created the training in 6 months, which was a terrible idea, and I don't recommend it. It was not, it was just a very like, I'm very proud of what we started with, but that was such a short time. It seemed like such a long time, and it wasn't. Um, and we were like, wow, is anybody going to show up? Like, and it was full. And we had people who were coming from different parts of the country and really wanted to learn how to support people through the abortion process. Um, and, I mean, that initial phone call that we had amongst ourselves and, that person who really initiated that idea of like, we have this, you know, uh, we have this base of knowledge ourselves, and we have, the ability to, find these other like find the other information that we need to put together a training that we can really feel proud of. Um, that was just super important, and I think there's a difference between saying like, okay, we can do this, like we have the skills, we have the knowledge to do this, um, and you know that doesn't mean that we thought we knew everything we needed to know or anything like that. It was just trusting in the ethics and the knowledge that we wanted to bring to this work in the first place. And so, we had a lot of help from other doula groups in different areas, and we got their permission whenever we used any components of any, handouts that they had or any things that they had, and we attributed anything that we used from anybody else in our training. And that's something that obviously we still do. Um, and, we had 2 in-person trainings um, before 2020, and we had one planned for spring of 2020. And it's probably not surprising we were not able to like have that in-person training, and it took a while to shift um, to the online training that we have now. And just to stay on track with that timeline, um, when I talk to people, because I'll have people reach out to me, like maybe they're traveling through Denver and they're from another doula organization, or they're someone who's interested in starting something similar where they are. Um, I think one of the most important things that you can do is to really, like, if you are someone who's trained in birth doula work, something that they will probably talk to you about is, you know kind of like not centering yourself in that process, in the birth, in the work that you do, in the work with your client, and really centering the person that you're working with. And that's obviously applicable to what we do. I've seen a lot of, especially leading up to Dobbs, I've seen a lot of groups and sort of um like kind of social media things, um with, I think a well-meaning effort to, oh, like, like the camping thing, like, oh, I'm going camping, like, da 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 da. um I my critique with some of the movements and some of the efforts to, to start those things and kind of have them on an individual basis is really just like access to how are people going to find you? How are they going to know that you're trustworthy? Like, these are worthwhile questions to ask yourself. And, and what already exists in your area. I mean, there's been a lot of other abortion funds and other PSOs who have talked about this, online and, in different places where, what already exists in your city, in your state, in your county, whatever. Um, that's probably the first question anybody should ask themselves if they want to start really any sort of mutual aid, or, abortion support, or, really any kind of grassroots organization, is what work is already being done. Because, you don't want to, it's not just about like duplicating work that somebody else is already doing, although that is part of it. Um, but it's also part about, like, if you don't know what organizations are already or might already exist locally, then maybe you need to, like, take a step back before you really surge on with starting your own org. Um, and so having an idea of who is already doing the work, who's already doing the organizing, um, how can you connect with them? Is there something that they would like to do but don't have the capacity for? Um, are there other groups that you can volunteer with, that kind of thing? Um, at the time that we started, um, there weren't any other abortion doula orgs in our area. Um, and there wasn't, now we partner very closely with Cobalt, which is an amazing abortion fund, and, we work with them on a daily basis. Um, they had not yet formed at that time. So, I think really having that sense of, who's already doing the work in your city is really important. Um, Colorado has been a significant location for a number of reasons. It's a receiving state, which means that, we have people coming from all over the country, primarily from, like, sort of the center of the country. The east and west coasts are pretty well covered. They have really great funds, really great providers, and, the sort of central area of the country is not so much. So we have people coming from everywhere, but right now our clients are generally like half and half Colorado, and other states. We have a high percentage of people coming from Texas, and then the remaining, percentages from a number of different states. Um, some of that is just geography. Texas is really close to us. Um, it is, I wouldn't say it's easy, but it is possible for people to drive from Texas if they want to. Oklahoma, sort of a similar thing. Um, so those are two states that we get a lot of people traveling from. And, you know, I think all the time about, with a lot of gratefulness for our early days doing a lot of like really slow, really like, it wasn't always exciting. It wasn't always like, the landscape was just really different. Like I said, when we began, it was before Dobbs, it was before SB8. The things were still, they were like not great, but the volume of people was just drastically different then than it is now. And I'm really glad that we had some lead up time to figure out, what worked for our area, our providers. We had some time to figure out some of the early kinks in, just things like doing airport pickups. Myself and Melissa, who I mentioned earlier, we were all volunteer for like years and years. We only started having any paid staff like 2 years ago, I think. So we were all doing unpaid, work for a long time. But Melissa and I were the ones doing the airport rides like pretty exclusively for a long time. And there were weeks where the two of us were just like making circuits back and forth to the airport. And during that time is when we figured out a lot of the things that informed the development of our trainings and the way that we guide our doulas to care for people now. Because Colorado has abortions at all trimesters, we have a lot more people traveling. There aren't a lot of places in the country where you can get that care if you need it. We have incredible providers here. And, that also increases the volume of people coming here. And, I think the part of our organization, the abortion fund, is tremendously important. And we are working with a really small budget. I have people asking me all the time now, what do you need? How can we help? And the thing that we need is money. Like the thing that we need is money. And I think for whatever reason, I know some of the reasons why people don't like talking about that and don't like hearing that what we need is money. But like that is what people need in order to get their abortion. They need money for the procedure. They need money for their plane ticket. They need money for their hotel. They need money for food. They need money. We need money to hire a sitter. And, and that is practically speaking what people need for any aspect of this, really. And, we have seen like a lot of, this is what you'll hear pretty much anywhere if you talk to anyone doing abortion funding or practical support, that donations have gone down hugely, especially with the election coming up. People are, really being vocal about like, they're putting their money to the election and not donating to, maybe smaller organizations and not donating to abortion funds the way that they might have before. Another thing that I'm hearing is people saying that, if Kamala Harris is elected, that the abortion situation will be fixed. That is absolutely not true. And that is not to say that I'm, saying that the election doesn't matter or that who's president doesn't matter. It does. But if Harris is elected, the bans and things that we see in the states right now are not going to suddenly change. And to be very realistic, they're probably not, a lot of them probably aren't going to change at all for a while. So the situations that pregnant people and abortion seekers are living in through the majority of the country is going to be the same. And so, I hope that people can keep, the positivity that they're feeling and temper that with some practicality about the laws that people are living under and the situations that people are living under. Just yesterday, we have, the name of a third woman whose death has been attributed to a ban in her state. And, something I've noticed about the three names that we have, the two from ProPublica and then the latest person who I think I heard from another news outlet, but is each of their stories are different. We're not they aren't the exact same scenario happening. One person, Amber Thurman got delayed care that led to her death, and I see a lot of people saying like, oh, it's because the doctors like whatever, like it's legal. The law is vague on purpose. It's supposed to hang people up. It's supposed to delay. And, you know, that delay in care is what killed her because sepsis acts fast and you don't have a lot of time. Candy, I believe it's Candy Miller. I apologize if I got her last name wrong. She didn't go in to seek medical care because it was her and her family's understanding that she would be arrested if she did. And so, that is what led to her death. And then this newest person, another young mom, whose name I can't recall at the moment, she died because the abortion ban in her state, I believe it was Indiana, created a care desert where there wasn't obstetrical care at all at the hospital that her husband brought her to. And there wasn't obstetrical care because of the abortion ban, because obstetrician gynecologists can't do their job in a state with an abortion ban. And she died of, complications from an ectopic pregnancy because there was nobody trained to handle it. And I think the fact that these three deaths, which are really just the three that we know about, have such different circumstances leading up to their death is really notable because, people want to think of these things, pregnancy, abortion, miscarriage, and the care that people need in those circumstances as being really tidy and really cut and dry. And, oh, well, it's legal to like save the life of the mother. Like, first of all, a lot of these laws will have lists of which complications you're allowed to classify as threatening the life of the mother. And if that thing that this one particular person has isn't on that list, then the doctor cannot provide an abortion. And we've got the vagueness, we've got a lot of, fear and anxiety with hospital administrators and lawyers contributing to this. It is not as simple because pregnancy and miscarriage and childbirth and all of these things are not that simple. I saw someone bring up the fact that, even at the stage of sepsis and, the twins that, Amber Thurman was already pregnant with, like, they had already passed. I believe they did not have a heartbeat at that time, but I'm not exactly sure of that. She would have still tested positive on a pregnancy test. So how we determine even like what pregnant still means is not as simple as people, really want it to be. Um, and it infuriates me that we had, even if these three women were the only people who had died as a result of any of these bans, it infuriates me that these three mothers and their partners and their children and their family, like that they lost their lives. Amber Thurman wanted to go to nursing school. You know, they had lives and dreams and things that they wanted to do. And all three of them should be alive right now. All three of them should be alive. They should have gotten speedy care. They should have gotten the care that they wanted and needed. And there was absolutely no good reason for any of them to have died. Um, you know, I think now, having been in this work for, you know, almost 10 years, I definitely got in the habit of, you know, got out of the habit, I should say, um, of saying that, you know, I've kind of seen it all, because I learned really quickly not to say that, you know, because there'll always be some situation and some story that I haven't encountered before. Um, but you know, the things that bring people to us for support are really different. Not Some people are in very dire situations, very dangerous situations. We have a lot of clients who are, you know, most of our clients are multiply marginalized people. Um, you know, they are poor, they are, you know, people of color, they are trans, they are, you know, in situations of domestic violence, you know, some are homeless. You know, they have a lot of different things going on. But, you know, we've also had clients who are, you know, about to start medical school and want to finish medical school. And, you know, as a parent of, um, you know, a young woman, you know, that really like activates something in me when we have someone who's like, I really just want to finish college. And, you know, and I'm like, and finish college you shall. Like, you know, we're going to make sure that like you're able to do that. Um, and they should be able to do that in the way that is best for them. Um, you know, the range of stories, the range of people, the range of situations for our clients is so vast. Um, you know, and it's, I really wish that more people who kind of opine on abortion and miscarriage and, you know, abortion care would uh, shut up and listen to anyone who has had an abortion, um, and maybe stop and have a little curiosity about what leads people um, to make that decision. Um, you know, I hope that, you know, um, I hope that when people, you know, are listening to me yap, um, that if they are excited about or curious about starting an organization where they are, um, I hope that they don't feel discouraged, you know, by anything that I'm saying. You know, when I say that there's a lot of like sort of boring work, you know, it's that's the stuff that really makes things easier for you later on. That's the stuff that makes your, you know, your organization better. There's so many different ways to do this. We are a 501c3, um, really primarily because there was another group that started about the same time that we did that had to disband for a bunch of just like life reasons. Somebody got married, somebody was moving overseas, you know, that kind of thing. And they came to us and offered to transfer their 501c3 status to us, which saved us a huge amount of money and heartache, because that process is really long and a real pain. Um, and being a 501c3 is right for some organizations and not right for others. It depends so much on where you are and the kind of work you want to do. And there is no one right way to do that. I think we have a lot of really necessary criticism of the nonprofit model happening right now. That's super important. And I just want to say that, like, the things that make nonprofits so prone to burning out their employees and duplicating a lot of crappy things from like bigger power structures and that kind of things, those are things that you don't have to do that. You don't have to do that. um you can stick to your ethics and make that the center of your work, and you don't have to you don't have to burn people out. Um and I have no regrets about us being a nonprofit. But I'm really grateful that we get to do this work with a number of groups who are not. And I think that, with especially with abortion access, because obviously that's the thing that I'm the most familiar with, um, having those different models and working all together is absolutely the strongest way to do this work. um, and having groups and people with different backgrounds and different ways of approaching conflict, with different ways of like organizing the structure of their group, like that makes the work stronger. And I don't know of any abortion fund or PSO that is working on their own. All of us are working with each other every single day. I joke a lot about having 72 signal chats, and that is true. But you know working on a daily basis with our local clinics, getting to know the staff there, knowing that we have these really trustworthy providers and being able to tell our clients so, is so important. Working with I love abortion workers so much. They are the coolest, bravest, most like radical, intelligent, kind, funny people I've ever known. Um, I am in and out of a lot of meetings and a lot of calls throughout the week, and I love this work. I love it so much, and you know, I'm so grateful to be able to work with people who really teach me every single day about how we can do our work better. Um, when I came to this in like a full time way a couple of years ago, and came on as director, I didn't. This is my only nonprofit work. This is my only organizing work. Um, I did not have any other nonprofit jobs. I was a nanny my whole adult life. I started when I was 19. That is the only kind of work I'd ever done. I did both of those things at the same time for a long time until that became impossible. And fortunately, that timed when I could shift out of nanny work and into working doing CDP full time. Um, I didn't go to college. I don't have any degrees related to this work. And, what I have is, I think a really steadfast commitment to this organization that I love so much, and to our staff and our volunteers that, that give so much of themselves, and to our clients. And, really all I want to do is like give, you know, tenfold back to them as much as they've given to me. Um, and I I'm very lucky to be in this. Um, I want to look at the time. It's 10:40, and I can definitely talk a little bit more about what CDP is doing now, and looking ahead at the election and stuff like that. I just want to do a little time check and make sure that that's okay.
Yeah, go for it. Everything. I'm so fired up and excited to chat with you, but um, yeah, why don't you sort of round it out by telling us what y'all are working on now and how you're approaching the next few months. I put a link to the the CDP website in the chat, which is
Awesome.
such a great site. And really, I think like showcases the breadth of ways that you support folks. I encourage everybody to give it a click. But yeah, tell us what you're working on.
Yeah. So, we have, kind of two main programs. One is our ADT, the abortion doula training, which anyone can take. It's all online. It is a suggested donation, pay what you can, no one turned away. We really want that to be accessible for anyone. And, that's something that also will be in continual development and improvement and that kind of thing. And then we have our ASN, which is our abortion support network, and that is where our intake team, our intake manager Anna, does absolutely phenomenal work. And what we're able to do with the ASN now is in large part due to what she's created. And so we have, like you said in the intro, Amelia, we have funding for abortions. And we also have, we do a lot of practical support. So, practical support is basically everything around the abortion itself. And a lot of the stuff with transportation, rides, flights, all of those things, a lot of that is really applicable for Coloradans as well, because if they're not in the Denver metro area, or even if they are, they may not have a car. There's all sorts of circumstances. And Colorado has, the Rockies going right down the middle of it. And if somebody's on the other side of those, there's a real void of clinics and providers in a lot of the parts of the state. It is really hard for people to get care. There's some areas of the state, like Colorado Springs and some of the smaller like mountain areas that are less friendly to abortion in general, and a lot um, a lot trickier to navigate for people who are in those areas. And also just like literally just the landscape itself can be a really big barrier. It's, if somebody is in Grand Junction, it's not, easy for us to, we really can't get somebody over there in time. So that's something that we're working on. In 2025, we really hope to be able to get into, more rural areas of Colorado, and reach people in some farther parts of the state. Um, we are looking at starting a drop-in post-abortion support group, because that's something that people have asked us about a lot. Um, and as far as the election itself, a lot of people, if you follow abortion stuff and or you follow us, that we have a really important bill coming up in our election, Amendment 79, to protect abortion in the Colorado State Constitution. That is very important. What is almost, for our work anyway, like arguably more important, is removing the barrier on Medicaid covering abortion in Colorado, because that we have a lot of clients who are on Medicaid, and if they could use Medicaid to cover their abortion care, that would be massive. That would help us so much. So, I'm about to be really annoying to all of my friends and family about voting, really primarily because of that. We're really lucky. We have a shield law in Colorado. We have incredible providers. We have not had the backlog. There was a period of time where we had a little bit more. It was harder to get an appointment here, but I think a lot of things have been like organized since then. In general, people are able to get in pretty quickly. And that's because we have a lot of providers who can can practice the way that they need to here. So we're really fortunate with that. And we have really great, like, we have really great clinics, and just really amazing people doing this work here.
You are really amazing, Gina. Oh my God, it's just been such a joy to listen to you speak today. And I, there's a question in the chat that is no question, just thank you so deeply for your work, integrity, and compassion. And I want to second that. It's really just uh, one of the reasons why we were so excited to have you as a guest is because um, you you are coming at this work from this approach of like I don't have a nonprofit background. I didn't go to college for social justice work. Um, I'm a really thoughtful person who has a lot of heart, and I'm brave, and I love this work, and I love the people that I serve, and I'm going to do my very best to do it well with my eyes wide open and surround myself with collaborators that are committed to doing the same. And, we really want people to feel empowered to get out there and do that. And also I think, like one of the things that you addressed in the beginning that I think is sort of like the dichotomy here is that we do know that like folks can sort of have a lot of enthusiasm um, and often I think paired with like a sense of urgency and can kind of end up like Kool-Aid Manning into the work, and can like create some form of harm, whether it's just like not being prepared really to deal with clients, maybe if they're interfacing with clients, or it's like stepping on toes in their area because they didn't even know the toes were there. And then I think there's a lot of other stuff that's almost more of a like uh, stylistic sort of issue. Like you talked about the camping thing, which it's like a lot of times I think that there's a great aversion in the movement to like folks uh who like don't have the right language and sometimes I think that like that can be communicated in like a less than constructive way.
Mhm.
And I don't want to hear someone's enthusiasm for the work and tell them to fuck off because they said it wrong. I want to
Mhm.
say, okay, I want to say, like, let's talk about why this camping thing is like maybe not the most helpful way to do this. And like you said, it's like it's difficult for abortion seekers to navigate sort of, like like intentionally opaque language that is like a little code word that was created in a Facebook group. That's not, people are already sketched out about who to trust and what their options
Mhm.
are. And this maybe isn't helpful, like in making people know who they are and aren't able to trust. And I think that that's a great example of like a person who clearly wants to help. Like they want to help people have abortions. And
Mhm.
they're like not necessarily showing up in the way that's most helpful to those people. And I want us as a movement to get better at like helping offer some constructive notes to those folks, but not just like telling them to go away unless they're like unwilling to hear feedback and just kind of like stridently proceeding while, causing harm. And then I think, that's a different conversation. But all of this is to say, I really like the fact that you are coming from a place of like, there's a place for everyone in this work, and
Mhm.
everyone has a different level of like education. And like, let's create a movement where everybody can find their way in. Um,
Yes.
you know what I mean? And so I guess like one thing that I think about, because you talk about how you like work with all different kinds of groups all the time. You're in all these signal chats, and your group seems to be organized in like a relatively informal way, in terms of like you're not a like, yeah, you have nonprofit status, but I get the feeling that, you know, you're more like three punks sitting around the living room kind of organized ethos than like a we are a nonprofit with like. But so I guess what I'm wondering is, do you have an internal decision making process? And second part of that question is, what is your like personal and or organizational approach to conflict, either within the group or in the communities that like in the movement work that you navigate?
Yeah. Oh gosh. Yeah. So we have like our core leadership group. And we just call it the core. And so that's myself, our deputy director, our intake manager, our development director, an admin, and some other people who aren't on staff but do really. We have one person who does Emily, who does our data. Somebody who like does this really specific thing that not a lot of people can do, and she does it really, really well. And as far like I think recently we've had um, some friction really recently about like I think some of it is related to growth where now we're at this point where in many ways we're not that far from where we were in the beginning. We don't have an office. We don't have like we all work remotely, um that kind of thing. And but like the growth in terms of we doubled our clients, doubled from 22 to 23, and it looks like, I mean, there's not that much long left to the year, but it looks like we're going to double them again this year from 23 to 24. That is that's so much. And I think that um there isn't enough attention given to how much work practical support is. All of the moving pieces of hotel reservations, and somebody might need 4 rides, 6 rides, something during their time in Colorado. Those
Mhm.
logistical pieces are massively complicated to organize. And Anna, our intake coordinator, and our volunteer intake coordinators do just a phenomenal job with that. People are also, we might have people coming in who, you know, they don't need to talk very much. They just want to get their care, and that is totally fine. And, whatever they need. You might also have people who like really are bringing a lot of like their stress and what they're going through emotionally. And our intake team does just an incredible job of just really being there for them and making sure like, okay, so we have client R, and she really needs some extra TLC, like, is anybody available to like blah blah blah. um it it's a lot of care work and a lot of emotional labor for our intake team. um I think as that growth can cause some, when I say friction, I think like pretty much all of us came to this like this CDP is our first and only experience doing like abortion access. And so, it's time for us to like tighten up what our roles are. Like, what are we all doing? um Everybody has a lot of autonomy, like you know in whether their job is grant writing or putting together a volunteer appreciation event or something like that. And I think we all try to help out with each other as much as possible, the small staff that we have. And we will go in and be in our chat and be like, hey, we have weekly check-ins, that kind of thing. And I think we turn to each other a lot and like say, okay, like, this is coming up, and like, what do y'all think about like this or that or whatever? So like we turn to each other quite a bit. on that kind of thing, on any decisions that are being made. And then, every once in a while, um, people will have like decisions that they just are part of their role and they make on their own. Um, and we have over 120 trained volunteers, which is just incredible. And everywhere I go, when I talk to people about that, anybody who has, especially like abortion orgs, they're like, you have how many volunteers? It's a lot that we've been able to maintain, and that's intentional. We really try our best to be transparent about what we're doing, to have a lot of varied things for people to do. Not everybody can do rides. Rides during the workday are mainly accessible for people who have flexible work schedules or maybe retired or something like that. That's not necessarily accessible if you're working like a standard 9 to 5 Monday through Friday job.
Mm-hmm.
So we have like a lot of other things we can do. We do virtual doula support now. So when people just want somebody that they can text with, maybe have a phone call with, while they're doing a medication abortion or something like that, we have people who can do that. So I think I am super annoying about like, and you can ask my partners about this. I'm like, well, have you just said to them? Have you just like asked them? Have just like, I think you should just like I think you should say this to them.
Mm-hmm.
Um, so uh, I think like being direct with each other whenever that's possible. And another thing that like is hella corny, but I really do believe in it, is like when you have friction or conflict come up with someone, that's an opportunity. Like that's an opportunity for yourself. Like if I find out that I am, contributing to someone feeling really unappreciated in their work or something like that, then like that's an opportunity for me to be better at that and to listen to them and hear how I might be able to do a better job. So it is corny, but it's also really true. And so those are some of the things that like I bring to like, we are lucky we don't have a lot of conflict and things like that come up. And we have, like I said, I'm never, ever, ever going to stop talking about how amazing our team is and how amazing our volunteers are. We have the best people in the world. And, we're human and, but we're all really dedicated. Nobody does, I don't know if this can really be said about nonprofit work in general, but nobody does abortion access unless they really are passionate about it and really have a lot of love for the people who are, who are accessing abortion. I said something on Twitter we have our organizational Twitter and I have one, like a professional one for me. And I said something last week where, I was like, the people who are bearing like the heaviest burden of like stress and holding the highest risk are our clients across the board all the time. It's not us. It's not even the doctors. And they are the ones who are carrying the most risk on a daily basis. And remembering to keep that centered even when, we're stressed out and, feeling overwhelmed. Yeah.
So there's a couple more things in the chat. One person is asking, how can we get involved with CDP? And there is a get involved tab on the website, which is amazing. There's another person that just says, I volunteer with CDP and want y'all to know it's organized so that when and if you can help, you speak up. If life is too much, it's okay. It's awesome that we needn't worry about overcommitment and just volunteer when able. CDP staff and volunteers are super supportive. And then also the training to become a volunteer is so awesome. You can walk in not knowing much and finish ready to be a safe, friendly face. Oh my God, it's time for me to cry. I cry every Abortion Academy. It's just
No, that's really,
it
yeah, that's really beautiful.
is.
Like I
It's so
said,
beautiful.
our volunteers are really, really the best. And I think, you know, So if you want to get involved either with us or if you want to take the training, anyone can take the training anywhere in the country, regardless of whether, and anybody in Colorado can take it whether or not they are going to volunteer with us. Um,
Mm-hmm.
I really try to push this as a good way to get yourself a better foundational knowledge, especially now, especially with all the crap that's in the news and the stuff that people are saying. It is a really good way to do that. It is all at your own pace.
Mm-hmm.
We really try to make it as easy as possible. And yes, so the training is a requirement if you want to volunteer with us. But volunteering with us is not a requirement for taking the training.
Mm-hmm.
And like the person said in the chat, the way that we have our signal chat for client requests, which is its own thing, is, if we say, oh, so and so needs a ride at Wednesday at 9:30, how we have that configured is you only answer if you're a yes or a maybe. We do not waste people's time with like having to justify why they can't do it. You do not have to do that. A lot of people who've had volunteer experience have had experience saying like, okay, well, these are my parameters and this is what I can do, and have the organization who's probably like really understaffed and strapped be like, super, I'm going to ask you to like do the exact thing that you just told me you can't do. We really try not to do that. And it's true that like our requirement really for our volunteers is that we ask them to commit to, if they're doing rides, one ride a month. And that's mainly just to keep you active and connected and being able to get a chance to like use the skills that you're learning. Um, and we also have a general chat where people can talk about whatever, they can ask questions. We do lots of pictures of people's pets and, you know, and our volunteers will be like, we're starting a reading group, we're starting a roller skating group. It's like really cool. Like they do, they'll go off and like start, these little groups themselves. Um, so, I really want to, I really want to plug the training just because that's a really great like gateway to, to finding out. And then, if you aren't in Colorado and you want to learn more about like, what might be in your area, um, the, the National Network of Abortion Funds has a list of, all their member funds in different states if you're looking for something in your state. We also work with Apiary, which works with a lot of practical support organizations. So we're in both because we're both. And they also have a list of partner organizations. One really simple way of getting connected to things is if you have an organization, you follow us, like look at who we follow, look at who we share, find out who might be, closer to you, and and just start paying attention. Show up at things, when they have a bingo night or, a taco night, or, if they're tabling somewhere, show up and talk to them. Come and talk to us at an event. Come and yap at us at our table. Like, we really love talking to people, and I'm not the only one who loves to run my mouth. We're all talkers, and the being a volunteer also offers a lot of possibility for connection and like making friends with people, and I think that's a little like side benefit.
Um, I have a couple like sort of nerdy or like technical questions. Um, One is like, can you talk a little bit about your volunteer vetting process? And it's okay if the answer is no.
Mm-hmm.
And then part two of that is like 170 volunteers is wild. And I'm wondering how, and it's also super, super cool that it's like so inherently flexible and you're giving people like a range of different ways to be involved and levels of time commitment. And I'm wondering if you can talk a little bit about like your volunteer management strategy or like
Yeah.
how the hell you do that.
So, there's a couple of things with our volunteer vetting. Um, there's no way to perfectly vet someone. And, we do we do ask people to make their social media um, available to us. Um, and that's mainly just because sometimes people will, be just really honest about like having weird opinions.
Yeah. Yeah.
And by weird, I mean um,
Like they're a turf or something.
yeah, like I'm not talking about like, I don't know, like aliens or something. And, we talk to them, we have an orientation um, that people can do. We also have an informational night where people can just kind of
Mhm.
like come in here just like on a little bit deeper level, like what is involved in being a doula with us.
Mhm.
And, there's some other like, kind of, we don't do like background checks or anything like
Yeah.
that. Um, but I think that, the best way to do that is to really, as much as this is possible, talk to people who are like be in conversation with them as much as possible, because usually people will kind of
Yeah.
themselves, like they're gonna say people who are, if somebody were to come in and were really anti-abortion,
Yeah.
I doubt they would be able to like really keep a lid on it.
Yeah. Yeah.
There
Totally.
would be something in there.
Yeah.
And I really hope that the Lord does not test me about what
Right.
I just said.
Right.
Um,
Right.
but it's that's one thing. Um, and then for volunteer management, we'd hoped to hire a volunteer manager this year, and unfortunately, like it just wasn't in our budget to do so. I really hope that in 2025 we can hire someone to do that. We had some really great candidates, and our volunteers really deserve someone who is focused on, maintaining those relationships and, and making sure that they're all getting what they need. Um, and and then I think we do go every so often, we'll go into the roster. And if there are people who haven't shown up for a long time, you're not going to like get in trouble or something. But
Right.
some contact you and be like, hey, are you still into this? Like,
Yeah.
do you want to do this? Um, and also like, we don't share any personal information, even in
Mhm.
the client request chat, like
Yeah.
you already kind of have to get into you will only be given that information directly when the person needs to ride.
Right.
Uh,
Right.
and so there's a little bit of that as well. We really try to keep their personal information as like, narrow as possible.
Mhm. It's really like astonishing to me that you have all of these people in the chat being like volunteering is amazing, and you're like there's 170 people, they're all just like doing what they're called to do at the level that they're able to do it, and you have no volunteer manager. Like you are stars. It's incredible.
Oh
um
God. I mean, again, like I think that I have a theory that like just when people go through our training and they go through those processes, it pulls in people who are really drawn to this work. And we have people of lots of different ages, lots of
mhm.
different backgrounds. The one thing that we don't have is we do not have a racially diverse group of volunteers.
Mhm.
That's another goal for us in the coming year, is really figuring out like what we can do to make sure that our volunteers reflect our clients, um, more so than they do right now. But we I think that people who are drawn to this work like really are exceptional people. And
Yeah.
we have some men who are doulas with us. There's no restriction on gender or anything like that. Um, and yeah, so it's yeah, like I said, I'm like, I almost feel like superstitious bringing it up. I'm like, things have been so great. We have this and I'm like, oh God, like what's in it? Um, but yeah, like it's hopefully we will be able to hire that volunteer manager soon. So if you have any sort of spiritual practice that
Yeah,
makes
I was
like
no, I'm sending you.
like
Hell yeah.
Yeah.
And I mean, everybody, like you said this, everybody, I think, in the movement is feeling strapped as hell right now in a way that's really scary. And um, I think that it has everything to do with, like you said, it's like people, the sort of like rage donations post Dobbs have kind of like dried up. And I have the same concern that you do about like that if Kamala is elected, that people are going to be like, okay, cool, abortion is handled. And like, obviously, abortion will still be restricted
Yeah.
in it will still be like essentially banned in like 14 states or whatever. But then even like these viability bans, like, and which exist in almost all the states
Mm-hmm.
at some point in pregnancy. And when you look at a Colorado situation where people can't use Medicaid and they're coming to have a $20,000
Yeah.
procedure, like that's not something that will change with a Harris administration unless Democrats decide to like fucking grow a backbone and like understand this issue all of a sudden, which I'm
Mm-hmm.
not holding my breath. Especially later care,
Yeah.
especially later care. And we're going to be hearing a lot about that for a long time. And, these ballot measures, it's just got to be said, a lot of these ballot measures are fucking up on that front, and it's
Mm-hmm.
setting us back, and it's using later patient care, patients who need later care as like a bargaining chip. And if you
Yeah.
haven't watched Erica Christensen's Abortion Academies, I encourage you to go do so. She is a brilliant later abortion care patient advocate and was a later abortion care patient herself. And, ultimately, we don't have any reason to believe that this country doesn't support abortion later in pregnancy. It's just that people have not really ever asked them to think about it. And
Mm-hmm.
politicians not knowing how the fuck to talk about it on our side is a huge part of that problem. And if you, as an advocate, are at all uncomfortable with this subject, I
Mm-hmm.
really encourage you to go engage with some of Erica and her partner Garen's materials at the Patient Forward website, which I'll put in the chat, or watch her Abortion Academy presentations. And I bring this up because it's a huge, huge part of the reason why Colorado is a
Yes.
totally, totally unique place in the landscape of care in this country. And it's a huge part of the funding crisis that's being felt movement wide.
Yeah.
Um, I
Yeah.
wanted to,
Oh, sorry.
no, no, you go ahead.
I just wanted to say two things too. Like, one thing I think is a unique opportunity with, with our organization is that because we don't have, a lot of the overhead and like, there's nothing wrong with an office. That sounds
Mhm.
lovely. But because we have a lot of those things, we when you donate to us, it is going
Mhm.
it is going to our clients, and then a portion of it is going to making sure that like us and that amazing team that I've been talking about can do our work and have food at the same
Yeah.
time. Um, so I want to encourage people just to look at it that way. And even though I talk about we have this tremendous need for money, which we do, um, we are supported so much by regular people who are giving their regular amounts of money from their regular ass jobs. And so, that's a big thing. And I think also like with, with later care and, all of that. And I think in these fucking horrible stories that we're hearing about now, I do think one thing that is shifting is now people are hearing more of these stories, and they might even know someone who is not, who did not get a ProPublica profile, who had, if they didn't die, they had like something really serious, and that's showing up more because of these bans. And the reason people thought these things were so rare is because, relatively speaking, a few years ago, it was, a lot of these newest bands are like they're pretty recent. It was at least a little bit simpler to get that care or have a provider in your area, and so we just didn't see them as much, and now we are. And and the other thing is, because there's some people who are like, uneasy about talking about later care or, any of these other things. That's another thing that people can do is really educate yourself, follow these abortion, go back and, if there are old ones you can listen to those things, listen to people, educate yourself, and do a little bit of work confronting that discomfort in yourself, because that discomfort doesn't help anyone. And it certainly doesn't help abortion seekers who, again, are the ones who are bearing the biggest risk and the biggest burden in all of this.
And like, don't feel, guilty or something if you have, like, most of us
Oh,
have
yeah.
stigma about later care. Like, it's not like it's just a thing that needs to be confronted, just like any other. We're conditioned by like the language around this and the lack of humanization of the people who need this care and those stories. It's like left this vacuum that's filled with stigma, and
Yeah.
like engaging with stories from people who have had later abortions and like really listening to those advocates. Yeah, that's how you unwind that shit. And it's totally, I feel like sometimes there's this expectation that like people, it's like you know that you're supposed to have the most radical opinion in order to like be on the right side of movement stuff, but you're sort of like embarrassed to ask the questions necessary to really
Yeah.
find your way to that place in an authentic like way,
Mm-hmm.
and that's not helpful either, because like you're not, and it's really, really okay. I think it's really important to
Mm-hmm.
find your own like philosophical orientation in this work by interrogating how the fuck you really feel about stuff, and finding, pushing through the things that come up in order to best show up for people. And
Yeah.
like, you know,
Yeah,
it's
absolutely.
what
And
it takes.
we have one of the things that was the most popular, and we used to do it in person, is one of the things that's most popular and most like we got a lot of positive feedback about it in our training was our bias exercise. And
Mm-hmm.
the thing is, everybody has biases.
Yeah,
And
totally.
and also, like, when I say that word, there might be like automatic things that come up in people's minds. There are things that you don't know about right now that like they're
Right.
like, oh God, I feel like really uncomfy about that. And
Mm-hmm.
give people the not the option. We give people the opportunity to look at some things where you're like, oh, I never thought about like
Yeah.
somebody who had 5 abortions, or I never
Yeah,
thought about like,
exactly.
you
Right.
know, what about with like one of the things with all trimester care is that we have a higher number of uh, very young people who
Yes.
are a lot farther along. And the reason that they are is because they're kids, they're doing magical thinking, they're hoping it goes away, they're really afraid to tell their parents, with
Mm-hmm.
varying degrees of like, how when I say valid, I just mean parents can be really surprising. Every single minor that we've ever had come to get any sort of later care has been coming with a supportive parent, has been coming with their mom and sometimes their dad too. And they're not coming on their own. They're not coming on their own to get a 25K procedure.
Right.
They're coming with support. And we have a parental notification law in Colorado that we hope to be able to challenge really soon. One of the things that's really great about it is that I know a lot of the people who like work on those teams and help teens who need a judicial bypass to get one. And
Mm-hmm.
they're amazing people. And they're going to fantastic providers that are going to give them excellent care. And, a lot of people don't know what that looks like.
Right.
And well, that's also another area of bias. So, yeah.
Yeah. I also I'm so glad to hear that like the young patients that you're seeing are well supported. One thing that I've learned from Erica, who I was just talking about, is like that there is, I think, a significant number of young people who need care later in pregnancy, who are, who are victims of
Yeah.
abuse, who are victims of
Mhm.
statutory rape, incest, and certainly like a happy family dynamic is like not the case in all situations. But I'm really glad that you have been, that you have seen a lot of supportive experiences.
Yeah.
So I think that we should kind of wrap it up. I want to
Yeah.
attempt to like make one connection though, because I was really struck by, um, that you were talking about just the three of you, I believe, like your initial founders, like hanging out and being inspired to like do this thing, and that you didn't have abortion experience, but you had birth doula ethical experience.
Mm-hmm.
Um, and you had experience with miscarriage and fetal loss.
Mm-hmm.
And I was struck by when you were discussing these three heartbreaking instances of people dying preventable deaths. Um, these three that we know about, and that we know that there are countless stories like this that we may never hear, but that these three situations were all different, right? Um,
Mm-hmm.
and they were all like, what you said about how Amber Thurman like had a pregnancy that no longer had a heartbeat, but she would have still probably had a positive pregnancy test, because that's the way that pregnancy tests work. They're measuring hormones that take a
Mm-hmm.
long time after a person has, an abortion to dissipate. And I guess, like I was just thinking about these two things and how much um, we are all sort of, I think, brainwashed in this culture to see abortion as this totally separate, different thing that
Yes.
is isolated and different from all other reproductive experiences. And in reality, the way that people experience their own pregnancies,
Mm-hmm.
understand them, and the way that these things are treated medically, there is a hell of a lot of liminality in these situations.
Yes.
And also, abortion bans are going to undermine reproductive health care for people who are giving birth to wanted and planned pregnancies,
Mm-hmm.
people who need miscarriage management, to people who are having medically indicated abortions, to people who are having non-medically indicated abortions, and everything in between, because the tools that are used in all of these situations are all the same shit.
Yes. Yeah.
And ultimately deciding whether or not this is an abortion is like the subjective opinion of a provider, or in some cases, a medical board of a hospital that's being leaned on by a bunch of lawyers to be as cautious as possible. And by cautious, they mean let this person almost die before you empty their uterus. And that is an inexact moment to try to find.
Yes. Yes. Mm-hmm.
Um, so I think that like my thought on that is just that I think that we all need to continue to understand that this is like a spectrum, that reproductive health care is that our reproductive experiences exist on a spectrum, and for us to sort of in some ways stop exceptionalizing abortion.
Mm-hmm.
But I also think that that's very tricky, because abortion is treated so different culturally, and we need to address that in order to combat stigma. You know what I mean?
Yeah.
And so I think that it's like tricky, because it's like I know that you understand what I'm saying, and probably most of the people listening understand what I'm saying. I also think that the public, and certainly politicians, are still very much in this headspace of like abortion is here, wanted pregnancies are here,
Mm-hmm.
miscarriages are here, life and death is here, and that's just not like, so it's like how do we begin to unwind this in people's minds while also recognizing, and how do we also like emphasize to people that like everybody's fucked by abortion bans. It's not just like
Mm-hmm.
abortion seekers or whatever.
Yep.
Um, and without sort of entrenching stigma by making that point. Do you know what I mean?
Yeah.
Like,
Yeah. Oh God, I know. I mean, I was talking to my sister who does a lot of end of life care, and just about the fact that, like, sure, yes, if if you have something catastrophic happen to you, the moment of death is really defined, but like,
right.
it's not always defined for it. It's
Oh,
like it can be really, it is really liminal. um, for a lot of people, as they are at the end of an illness or the end of, old age or things like that. And that's a whole other topic. And maybe I'll write about that sometime. But like, that liminality, I really do think that underneath all the other things, all the other stigma about sex and about women and about people who have a uterus and what we think about people who have a uterus, and all of that is this real fundamental uneasiness with the liminality of a lot of these stages
Oh yeah.
of life. And that is what is really getting at people, because they want
Yeah.
things to be tidy and just not.
Absolutely. And I think that I think that most people that find their way into abortion work have a deep wiring of like understanding of that. You know what I mean? Uh-oh, I think I'm freezing. I may
Mm-hmm.
oh, I hear you saying but one of us
Okay,
is
not on
freezing.
my end.
Am I moving? Am I speaking? Okay, maybe it's okay.
You're moving to me.
My internet is really shitty and it's a nightmare, but this is probably a good time to call it anyway.
This is
Gina,
not your fun. Yep.
yeah, I could listen to you and chat with you forever. You are brilliant. You have so much heart. I'm so glad that we had you be a part of Abortion Academy and talk to people about just like getting out there and helping people in their communities. And it's just like been an honor and a pleasure to talk to you. And we love you.
Thank you so much. This was really, really great. And yeah, I'm just super appreciative. And, it was really fun. Thank you so much. And thank you to everybody who showed up and listened.
Yay. Okay. Thanks, everybody. We'll see you next month. And thank you so much to our interpreters as well.
Mm-hmm, mm-hmm.
Yeah, and
Sorry, I
Diana.
probably did talk too fast.
Okay.
Okay, bye.
Everybody have a good day. Thank you. Bye.